Well, want to thank everybody for joining us today online, and for those who are going to be watching this a little bit later in the comfort of their home. Welcome to the Autism Australia Ought to Know webinar series. My name is Kathrine Peereboom, and I am your host today. Today, we're going to be covering a topic that I think a lot of people in our community have fights and struggles with. And today, we're going to bring some clarity to that: navigating health systems. And just before we do get into it, I want to let you know that Autism Australia hosts these wonderful webinars covering a range of different topics on a monthly basis. So if you haven't joined their newsletter or join their social pages, please make sure that you do. They are across Instagram, Facebook, TikTok, and YouTube. And we want to make sure that you never miss out on a resource or information that you require. Today, I also just want to acknowledge our sponsor, which is Autism Aspergers Advocacy Australia, or A4 as they are known. They are a national volunteer-led organisation representing autistic people, their families, carers, and associates. And we are very, very grateful for their support on this particular webinar. Now, it is my absolute pleasure to introduce you to our guest speaker today, Dr. James Best. He is an award-winning GP with over 25 years experience, specialising in child development, behaviour and disability. A father to a son with autism, James brings both professional expertise and personal lived experience to his work. He is also an accomplished author, with his book being called Sam's Best Shot. So please make sure that you check that book out as well. Welcome, James.
Thanks, Kathrine. Thanks very much for that kind introduction.
No, you're very welcome. Now, just before we get into it, I just wanted to let our audience know that we do have a Q&A panel open. And one of our friendly team are going to be monitoring the questions. And there will also be an opportunity at the end of this webinar to answer audience questions. So if you've got anything specific, please write it in the chat panel, and we'll get to them as best as we can. So, navigating the healthcare system with confidence. Dr. James, why is healthcare harder than it should be for our autistic people and their families?
Well, I think that's a very good question, Kathrine. And it is harder than it should be. There's no doubt about that. I think that when you're thinking about this as to why, I think there are factors from the autistic individual that are a factor, and there are factors from the health system as well. Obviously, autistic people can often have sensory issues. They can have communication issues that make it harder to get the messages across they're trying to get. Even organisational issues, just getting to a doctor's appointment or to a hospital, or especially if you're sick, and makes it all more harder. I just saw your cat or dog flit across the background there, Kathrine.
Sorry.
All good, all good. So from, and certainly from what I hear from my patients and from other people I've spoken to, when they're describing the process of physically accessing or even virtually accessing a health visit, and then trying to get across what messages they were trying to get across and trying to be taken seriously and all this sort of thing, it can be extremely hard and to the point of even traumatic. And I remember a mother describing to me the process that she went through to get to a doctor's appointment once, and it started from when she woke up, or when they woke up, through, even though the appointment was in the late morning, it was hours of struggle. And you got from the home right through to the transport, right through to a waiting room, perhaps right through to actually getting in the room. All of these barriers that are coming, these challenges and these stresses that are coming. And also then you have the health system itself, which of course can vary enormously. It might be accessing a GP or a dentist or someone else in primary care, which is where you meet the first people you meet in the health system, and that you might have known for a long time, and so that may reduce the challenge and reduce the newness and the distress to the individual and their family, right through to being in a hospital, in a ward, or having an operation, or a procedure of some sort, or an emergency department, which we might talk about later, which is the most sensory of environments. And of course, within all of those different settings, the variation can be enormous, from someone who gets it, who understands, who is appreciative of the experience that the individual and their family are going through, right through to someone who just does not, has attitude problems, is disrespectful. Uh,
Just not knowledgeable.
yeah, just aware, as
Mm.
autism awareness. That's who we're talking to. It varies enormously. It could be someone who has absolutely no idea about autism and the challenges of things like sensory issues and communication issues, to someone who really does get it. Maybe someone with a relative, maybe someone with autism. The variation is enormous in terms of the setting, and because of that, we constantly see. Unfortunately, we often see issues in terms of how people feel afterwards, during and afterwards from that experience.
You have just um, in such a short window of time expressed so many of the day-to-day concerns and issues that our families go through. And it's thank you, one, for unpacking that and just acknowledging some of the challenges that we face. And I can tell you from personal experience, I have 3 boys with profound autism, for those who are new to me. And I have absolutely gone through nearly check mark on everything that you just said. I think some of the things that I've now really started to focus on is building those relationships with people who have empathy and who have understanding for our situations. So when we go up to our medical centre, which could typically have a 2.5 hour wait in peak periods, I can call ahead to our GP. They will have a sensory room for my boys, or whichever one it might be. And then we get triaged. And that is the difference of an experience with somebody who understands who you are and what your family is going through, compared to some of the systems that we've had in the past, where we have waited in a hospital ER with meltdowns for 8 hours, and I've literally given up, bawling my eyes out, and brought my son home because it was safer for him, and it was just too traumatic. So, I mean, we've really spoken already about the disconnect between some of our health systems and the community. So let's now talk about how we can be proactive. What do you think that families underestimate a little bit about preparing for appointments? And most importantly, what are some of the things that we can do to just make it a little bit of a smoother experience for everybody involved? It's never going to be perfect. We know that. But what aren't we doing, and what could we be doing to make it better?
Okay, you mentioned the word underestimate, and I think that that's quite understandable. I think it's quite a reasonable expectation that you would go to a health system, or to a part of a health system, and be treated with respect. I think that is quite a reasonable expectation. But the problem is that the coming from within the health system, where you're dealing with, say, for example, an emergency department, where you're dealing with people coming through the door and it's chaos and it's overwhelmed, and the system is already overwhelmed. And so even if you've got good people within that system who are kind and doing it there for the right reasons, if you have that, that just their environment that they normally deal with, where 6-8 hour waits are normal, for non-triage 1 presentations, that is normalized, and you get, as a person within that system, you get a bit indurated, you get a bit tough, and you're just like, yeah, I know everyone's got to wait, and you lose context of that it's harder for this individual because of their autism. It's harder for this family, and that behaviours happen. And as soon as behaviours happen, it can escalate. So the people do underestimate this coming from the autism side. They think, oh well, surely we're going to be taken seriously, and surely we're going to be treated with respect. But because the system is under stress already, sometimes that doesn't happen. And so, in terms of what you can do, okay, first of all, be aware that you may not always be met with the sort of meeting the expectations that you would expect. Be aware of that. Prepare for the worst and hope for the best, and psychologically prepare. Say, okay, this may not go well. Okay, that I'm going to, and we need to keep calm about that, because it's the emotional overlay that happens when you're going through that horrible experience. You just go, this is not right, and that can make the whole things worse. And I think if you have a child with autism in an emergency department, you'll be getting distressed. They'll be getting distressed. They'll be sensing that you're getting distressed. So realizing that it may take a while. The other thing you can do to prepare is have resources that will communicate to the triage nurse, or the ED nurse or doctor, something written down on a piece of paper and laminated. This is, my child has autism, and this is what that means. The sensory da da da. It's something very brief and clear. Having a health summary from a GP, if you can get the GP to do that, that's fantastic. Including a description of behaviours, a description of sensory and communication stuff. So in case you meet a person that doesn't understand autism, have it on if you can, get your normal GP or other people that you deal with in the health system, maybe a paediatrician or someone like that, to put something on My Health Record and tell the triage nurse and tell the doctor or the nurse in the emergency department, hey, look at My Health Record. I know my doctor's put something there. So resources and organisation beforehand can sometimes help get over these barriers. Yeah. So
preparation.
Yeah, and have a spiel in your head. This is just so you know. Like,
Absolutely.
I know that everyone's got to wait 6 hours, but hey, if you make this kid wait 6 hours, it's all going to go very much pear-shaped. Yeah. And it's got beyond his or her control, or so it's not that they're just being a jerk, right? Which is often the perception from the other side, is like someone's misbehaving in the waiting room because they've got to wait. Well, no, other people aren't. So it's just understanding the way that it is a two-sided conversation.
Yeah, and look, I think from lived experience in my earlier days, where I had so much fear and guilt, and I was trying to navigate keeping, my children safe, and they were going through obviously a lot of issues with their health. We're seeing a GP, or we're at a hospital, or wherever it might be.
Yeah.
And I think what I've learned over the years is preparedness. And if one of the things that I do, and I talk about it quite a bit, is I do create this, what I call a Bible, which is a profile on each of my children. And I update it on a regular basis. And this is something that when you do have a situation that could be an emergency, you don't want to be focusing at that time on, what do I have to remember? How do I get it? So if you've already done it, and you can just bring it to the appointment, and it covers things like their diagnosis, it covers things like any medications that they might be currently taking. What are my top 3 concerns that I need you to understand about my loved one, so that we make sure that this interaction is a smooth interaction. And making sure that they also understand what those behavior triggers are. My eldest son now had 6 lower limb surgeries where he was in and out of hospital under multiple anesthetics, general GAs, in a 6-month period. And he's absolutely traumatized and petrified of taking a step into any doctor's office now. And now we're on the other side of helping him through PTSD and trauma recovery and repairing the relationship between, health professionals and him, because he's going to need care for the rest of his life in different ways. So I've really found that medical profile, if you like, has really been a game changer. And I hope someone in the audience today takes that away. And it doesn't have to be 16 pages long. It's just an overview
It's better
somewhere
if
in
it's
your
not, actually.
yeah, absolutely. Concise little bullet points.
Yeah,
And you can apply that to everybody in the space, GPs, dentists, hospital visits. So I think it's something that we can really look at. Now,
I was just going to say, I'm really
sorry.
glad you mentioned trauma there, because it is very common that trauma is an issue, and PTSD sort of aspects to that trauma. What's happened in the past can affect what's going to happen in the future, and in terms of interaction with the health system. So yes, and preparedness and everything. But sometimes preparedness is not that easy because it's already so hard to
Sure.
get in the car, get the, all that, wait through the waiting room, all that. So yeah.
And look, feel empowered parents too, if the situation is truly overwhelming for you, please feel empowered to call 000. Please feel empowered if you've got a doctor's service that will come to your home. Feel free to utilize that. One of the things that I do now for basic medication, antibiotics, if they have a green nose, is I use an online telehealth service that charges $45 for the session. And I know that may not be affordable for some people, but it is certainly a lifesaver for me. So I don't have to take them out of the home, out of their safe space, for that period of time. But taking that lens now, you're a GP of over 25 years, you're highly respected. What should we be expecting from our GPs? And ultimately, how can our community help you to help us?
That's a great question. What should you be expecting? You should, number one, be expecting respect. Okay, that's what it all comes down to. And that is going to vary from individual GP to individual GP. And so if you're not finding respect, I think you should go somewhere where you can keep looking around until you find someone who's going to treat you and your child or adult with autism with the respect they deserve. And that, if you have that as your cornerstone, everything else flows from that. So, preparing, negotiating about how an appointment happens, waiting room stuff, sensory stuff in the building, having a first appointment available, having a long appointment available, an understanding, seeing someone in a car park. All of these things that happen in varying degrees in varying surgeries, it's all underpinned by the fact that I'm respecting you and I'm going to sort of work around what your needs are. That's what it all comes down to. So,
Yeah,
so
sorry.
I was just going to say, this is what I talk to other GPs about when I'm talking to them about autism, and because most people want to do the right thing. Most health professionals want to do the right thing, but sometimes they just don't get it. And so you trying to communicate to them, these are our needs, right? This is what I'd like, and maybe can we talk about this before you get on to assessing the flu-like illness they've come in with, or maybe even better, doing it at a time when they're not sick, like a healthy check, sort of a
Yeah.
healthy child check or a healthy adult check, and getting them familiar with, here's an horoscope, this is what it looks like. Here's a stethoscope, put it on yourself, so they're just more comfortable in that environment. I think also another thing just to say is, part of that respect is a GP or a health professional who actually takes notice of the child, even when the child is ignoring them.
Yeah.
Because I think that's often the default is you're used to talking to a patient and the patient interacting with you as part of that thing. But if you've got an autistic child who's not got no eye contact and is not verbal and all that, it's very easy to just go, I'll just talk to mum.
Mm.
He or she's over there in the corner mucking around with the toys, and I'll that's okay. So that I can just talk to mum. I think that's really something I tell GPs not to do. To keep trying to push. If a child is interacting with you less because of their autism, you should be trying to interact with them more. And I think as soon as, and I tell GPs like this, as soon as you do that, the parents or the relative, the carers or the support workers of that child will really like it because most
Mm.
people don't.
Yeah.
So
Interaction, it's really critical, and you did touch on this, and you did mention this also on the panel at the Profound Autism Symposium, which is coming in for a health check when they are well,
yeah,
so they get to, put the stethoscope on and get on the scale. I mean, I know just getting my boys on the scale and trying to get their height and weight can be a challenge, let alone, taking their heart pressure and things like that as well. And so I mean, we've already sort of spoken a lot about some red flags and misunderstandings. Um, where do you think clinicians understand autistic patients, and what red flags should you never ignore? I mean, you've touched
yeah,
on respect, and I think if you're feeling disrespected, and if you're core is saying to you, this doesn't feel right,
yeah,
listen to the voice and exit. But
yeah.
what else should we be looking at from a behavioral point of view, from a
Okay, so I think it's really good to talk about this, Kathrine. What should you have your antenna out for? In this interaction, I think language. If someone uses a derogatory term or says, you're just a problem, or something, your child is a problem for me, something like that. If their attitude towards the individual with autism, whether it's your child or yourself or someone in your family, the it's that attitude, that language, that once again coming back to respect. I'll give you an example that's got nothing to do with autism. It was an old demented guy that I look after in a nursing home, that I had to get a skin cancer cut off by a surgeon in the local hospital, and the daughter who took him to the appointment. This is more about disability than about autism specifically. Um, Said that the surgeon, she had to go into the operating theatre with the guy, and the surgeon complained the whole time that this guy was making her day worse because he kept on try and climb off the bench, and he wouldn't sit still, and she's just trying to do a skin graft, and she's used to doing skin grafts all day, and but all of a sudden she was really complaining to the daughter about this was making her days harder. And I'm thinking, well, I was making the guy's day harder and the daughter's day harder, and I was so disappointed to hear that, as a colleague of this medical colleague was treating this person with such disrespect. Just
mm,
because he had dementia didn't mean he was not a person, and he didn't deserve respect. And and the fact that it upset the daughter so much. So I think it's just very similar to what I hear a lot of my autistic patients talking about, or the families of autistic patients when they go to emergency departments and they get this sort of stuff. It's just that basic respect. Um, to identify someone as a problem, as a difficulty that they don't need. This is the sort of stuff that are the red flags for me. And I'm
yeah,
sure
and
everyone, would be very quick to sense that if I ended up in an emergency, or a GP,
yeah.
or a dentist, or wherever. Yeah.
And that's exactly right. And I think when you have the opportunity, to do that medical summary page,
Mm.
that also assists. And I think we need to remember that we are, if our loved ones are not able to self-advocate, and we are their primary voice, that we need to make sure that we understand what's happening in the room. We are the then expert of our loved ones. So if we can start to see behaviours changing, selective mutism or escalated
Yeah.
stimming in certain ways, or echolalia is really starting to become more
Yeah.
prevalent. We are the experts on our loved ones. So we have to stay calm and then feel empowered to say to whoever
Yep.
the
Step up. Yep.
step up.
Yeah.
and
Now,
just say,
can I
look,
just
this
can I just
isn't
elaborate
working.
on that?
Go
Okay.
ahead.
That if you identify something like this happening, if this starts happening, someone starts treating someone with disrespect, someone starts saying, "Oh, you're a problem, you're a difficulty, blah, blah, blah. This is making my day worse," whatever. Keep calm, as you say, but be assertive. I sometimes wish I could put myself in the shoes of people who are going through these experiences when I hear about them afterwards and say what I would have said. Now, I don't say this to the patient because I don't want them to feel bad, but personally, what I would like them to be able to say, and this is, I suppose, speaking to the audience, is say, hey, it's not his fault that he is doing these behaviors. It's because of his individual life experience. And can you please treat him with respect? Right.
Mm, definitely.
That's all I'm asking. Okay. And you've still got to get the procedure done. You've still got to get the vaccination done or the dental thing done or whatever. And that they're the technician who are doing that. But while you're doing that, I expect, I'm saying this calmly and respectfully myself, but I'm expecting you to treat my child or my person in my life with respect. That's what I
Mm.
expect. Now, that's not easy to do, especially when you've got what a person is often perceived as in a position of power. But if you can do it, I would encourage you to do it because even in that really tricky
And utilize your
situation.
network, right? Utilize your
Mm,
network. Some people, they may have a disability themselves, or English is not necessarily their first language, and
yeah,
they uncomfortable challenging that authority. And if that is you, then please feel empowered to ring your support worker or a coordinator or somebody that can help you find your voice. You will get better at it and you will get stronger at it. And it can be scary at times. And I want to just quickly now transition because we are running out of time, but I do want to quickly transition into hospitals and dentists and complex care. And look, I know for my children, and this might be controversial for some of our audience, but in the profound cohort, we simply can't brush our teeth. So a dentist appointment for us is sadly under a general
yeah,
anaesthetic with long wait times.
yeah,
In those experiences, I have been fortunate enough to find, people who will assist me who do have that empathy, and really are caring about the individuals and their sensory needs and what it might be. But whilst they go under for a simple dental clean, we're taking blood. So I've coordinated with the pediatrician, the dietitian, the GP. I've coordinated with every person that I can think of to make sure that we're getting everything that we can done. And I know here in Queensland, our systems are still siloed. In New South Wales, they now have the phenomenal one-stop shop model, which, if you haven't heard of that and you are based in New South Wales, please look at that resource. And we also have the Primary Health Networks program as well, which is available to individuals. But just with complex care, James, do you have any thoughts that you can share with our community today that might make that a little bit more comforting or easier?
Okay, look, unfortunately, I haven't got a great answer for that. You right to mention One Stop Shop, and there are some great little programs in different parts of Australia that will trying to address this need. But at the end of the day, it's a countrywide, system-wide uh, phenomenon. The more complex you get, the harder it can be in a siloed health system. So, and I suppose that often comes back to the GP is meant to be the coordinator of all the different aspects and have be the center of the wheel with the spokes going out to the different parts of the health system. So I suppose it often comes back to that. Finding a good primary health care worker, usually a GP, that can coordinate this sort of stuff and direct you to the parts of the health system that are going to work the best. So, and trying to tee up communication with that particular say for example you're seeing an orthopedic surgeon or you're seeing a neurologist about epilepsy or whatever that you have in your letter that this is as well as the patient having in their own information that they take to the specialist or the dentist or whoever it is, that this is our situation. Yeah, there is no easy answer. It is the siloed health system. The states run hospitals and GPs are paid by the federal government, and it's all over the place. And then there's private services, and yeah, but
just to we're running out of time, and we've got a couple of questions that I do
sure.
want to get covered, but let's just leave on a little bit more of a positive note. Where autism now is a conversation that is happening
all the time
in government, in policy, in the media, in homes, that it was never spoken about, in education settings. So where is the system improving, and what can we look forward to as
look,
the next 5-10
there
years?
is no doubt that the system is improving, but there is also no doubt that there is a long way to go and it's patchy. You've only got to look at TV shows and stuff like that, in books and stuff, to see autism's being talked about everywhere. I was watching an episode of The Pit the other day, which set in an emergency department in America, and they had an autistic doctor and an autistic patient. And I thought, oh, that's fantastic. And it was very well done. That you're seeing a lot more awareness of this sort of stuff. And there's a lot more awareness happening, including in general practice, but also, I would say, in hospitals and emergency departments, that people are aware. The fact that there is a quiet room, a low sensory room in your local medical centre that you go to. There you go. There's no way in the world that would have happened 10 years ago. So it is improving, and maybe you need to find the parts of that health system that were doing it better, if you can, and that's going to be locally dependent. So yes, it is improving. Awareness is improving. The ability for people to treat people with autism with respect, I think, is improving. You've also got to remember that health professionals themselves vary a lot in terms of age and experience. You got a 25-year-old freshly out of university right through to a 70-year-old who, back when he was training, autism didn't exist. So we are evolving, but it's a slow thing. And I can tell you, being on committees and government policy, committees and stuff like that, there's a lot of talk about how can we do this better, including having autism people in the conversation.
Absolutely. Look, I'm going to now just run through a couple of questions that our audience have got for us. There's a lady here who has said she's just simply not being taken seriously. Her 16-year-old requires blood tests.
Yep.
And has a severe needle phobia, and people are just saying, well, tough luck, he's just going to have to do it. So we've spoken at length about the negative side. How can we help this woman with a little bit of advice as to how can she get this done and be acknowledged?
Okay, well, that is a conversation that should be a two-way conversation. It shouldn't be tough luck, you just need to get this done. It needs to be, okay, let's see what strategies can we use to make this a less traumatic experience. So you need to be able to, you should be trying to have a conversation with the right sort of person who will have that conversation with you. Now, if you live in Burke, and there's one doctor within 400 kilometres that is not that person, that makes it really tough. But if you do live in an area where there is more options in terms of which, and network, find out who is going to be the right person who will take you seriously. They do exist. They do exist. So sometimes it can be quite hard to find, but I suppose that's the key. It's you need to have an advocate who's on side.
And look, sometimes communication from you doesn't have to be verbally and face-to-face. If you find that confrontational, send an email, send several emails and say, this is who my child is. This is going to be his reaction. And I need a proactive solution that we can work together to make sure that he doesn't walk away traumatized. We had to get blood tests for my middle boy. In the end, we tried a whole range of different things, and we managed to just get a gas mask on him. We didn't have to put him under a full GA this time. But we managed to get him just relaxed enough that we were able to get the bloods without traumatizing him, and then we got oxygen back into him, and he was there. But the nurses and the team there were absolutely wonderful. So use your voice and communication methodology that is suitable for you. I've also got another question here about pre-admission planning for post-operative care. And how does a parent trigger the conversation about accommodations that will be needed, and whether the NDIS concurrent supports can be put in place, whether it be in hospital or in the home? What's appropriate here?
Right. Look, I must say I'm not entirely sure about what NDIS supports you can get for those sort of. I don't think NDIS covers anything to do with inpatient care in hospitals, but post maybe. Sorry, you'd need to look into that yourselves. But in terms of planning, absolutely, you 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 really want to do that. And I strongly encourage you to plan to have a very detailed plan, have a lot of thought, talk it through with professionals if you can about this is the way this is going to work, hopefully. Now, even if you do that, it still might not work because, they get a change in shift and someone comes along and who doesn't get it, or bumps them to the end of the list, or, doesn't give them the pain relief on time, or whatever. But trying to plan does reduce risk, or actually going through to plan and trying to think what strategies can we use here in this environment, because I've seen many examples of where it doesn't go right, and planning will help reduce
Yes.
risk. It won't eliminate risk, so that's what we do. Hey, a generation ago, there was not even an opportunity to do any of this. So at least now we have the opportunity to do it. And organisations like Autism Awareness are getting people like me to teach you, to talk to you guys about this. Hey, try to plan, try to prepare, get organised, find the right people if you can. Yeah.
I remember one of my boys' first day of school. Another student slammed a metal door, and we broke fingers. This was day one of school, and we went to the hospital. It was great. The care team there were phenomenal, and I said to them, I'm not stressed about him being in here with you, because we've got every tool that we require in this hospital. What I'm stressed about is how he's going to leave this plaster cast on his arm now for the next 4 to 6 weeks, because I can guarantee you he's got severe pica. He's going to gnaw this cast off, and we're going to be ending up seeing you every 2 days. So how are you going to help me with that? They all went away and they ran around. But the most important part was that I spoke up. You know your loved one. I'm just going to wrap this up now because we've definitely gone over time. But you know your loved one best. Find your voice. And if you're not confident in that, write the email, find somebody else in your network that can speak for you. Please make sure that when you've got time, it doesn't have to be a rushed thing. Start creating that medical profile for your loved one that covers the diagnosis, the medications, the nappies that they might still be using,
The behaviours,
the sensitivities, the behavior triggers, some of the de-escalation strategies that might work. If you've been in hospital plenty of times, talk to them. This sedative isn't going to work if you put it up the nose, or if you try the oral one. We're going to need to go straight to the ketamine needle. You know your loved one. So, look, thank you so much.
That's quite right, Kevin. Can I just say, I just saw in comments there, how do you find the right people? Network. Just, ask other people, find out who they're out there. You just got to find them. I think that's really the important bit.
And talk to your community. Get onto the Facebook groups. Find your tribe. There are a lot of toxic tribes out there, but there are lots of good ones. And in your local area, find a GP or find somebody that has really worked for your loved one. Share the knowledge. Share the knowledge, guys. Look, Dr. James Best, I cannot thank you enough for your expertise and time on this Navigating Health Systems webinar today. Thank you so much. To our audience out there, I just want you to know that this webinar will be sent to you via an email, via the link in a couple of days' time. And also the Navigating Healthcare Systems from last year's Profound Autism Symposium will also be going up on the YouTube channel. So please make sure that you keep an eye out for that, because that was just an eye-opener of a conversation with Dr. James and a few other wonderful panelists. I do want to say again a big thank you to our sponsor, A4. Thank you so much for all of your continued advocacy in the space that you do. For the newbies who are still new to Autism Australia, please make sure that you go to their website. They've got free evidence-based resources covering every single topic that you could think of, from early ages through to senior citizens, and they cover such a wonderful range of topics. So jump onto their website, subscribe to their newsletter, and jump onto socials. They're on Facebook, Instagram, and TikTok. Once again, thank you all for joining us today on this webinar, and we hope to see you at next month's webinar. Thank you so much.
And thank you, Kathrine, and thank you everybody for turning up, and all the best to you in navigating the health system.
Thank you, everybody.
Bye-bye.
Bye.